Hi there, my name is Dr. Steven Shoshany. I'm a chiropractor here in New York City in the Soho, NoHo area. The practice I work in is multidisciplinary. What that means is we work together. So there's chiropractors, physical therapists, and medical doctors working together to get the patient better faster. The emphasis on our practice is on difficult to treat back pain patients, people that have herniated discs, sciatica, and unresolved back pain. We treat patients that have failed back surgery syndrome. So I recently stumbled across on social media an article that was published by NPR about the prevalence of low back pain in nurses. What this study said is despite any proper lifting techniques, nurses will specifically get career-ending back pain injuries. And this also applies to people that are paramedics, to nurses, to nurse practitioners, to anyone that is moving patients in and out of beds will suffer from lower back pain. It may be that it's almost inevitable that these people are going to suffer from back pain injuries, but what I found in my practice over the past 20 years of treating patients is a combination of chiropractic adjustments to keep their spinal alignment and their biomechanics sound, and core strengthening with physical therapists, keeping their abdomen strong, keeping their back muscles strong. These patients are less likely to suffer back pain, and if they do have a back pain incident, following care with a chiropractor and a physical therapist will get patients back to work quicker and without side effects. One of the things that the article did not mention is that sitting contributes to poor posture and back pain, and then these nurses would sit for long periods of time and then go lift a patient. That's a combination or a formula or recipe for disaster. Addressing the patient's biomechanics, their spinal alignment, and their muscle tone is what's necessary to prevent these injuries, and people can have long careers without devastating back injuries. Traditionally, when a patient is injured or a nurse is injured, the medical treatment, putting a patient on medication, can actually make the situation even worse, because then they don't have pain, and pain is your body's way of letting you know something's wrong, so they can have more devastating of an injury. Our approach of chiropractic care and physical therapists combined, is a much more big picture approach. What we're looking to do is correct the spinal alignment and strengthening the weak muscles, so when the patients move, there's less stress put on these very vital and sensitive nerve endings. In my experience, I've seen patients come in that have had back surgeries without good results. Back surgeries are often, or in my book, should always be a last resort, and when you've exhausted all conservative measures first, like chiropractic care and physical therapy. There is a time and place for surgery, but it's often overutilized. So if you have a devastating back injury, see a chiropractor, see a physical therapist before getting a surgery. I'm going to be updating my page, so if you want to learn more ways on how to prevent back pain, be sure to follow me on YouTube, and also my Google Plus page is Dr. Steven Shoshany Chiropractor.